on in our DC library system. And so MLK staff had hoped to join us today to talk about that. But we do have here a link that I've just put in the chat for people, which provides a link to their website where it's got a calendar of all their great events. It's the month of July, but it actually starts this weekend. So people can take a look at that and attend any of those events you're interested in. We have two presentations today. First, we're going to hear from, I don't know if we've talked about this before, RSA with our VR, our vocational rehabilitation grant is required every 3 years to do a comprehensive statewide needs assessment. And so that's in progress right now. And PROMESA, which is the local group, and San Diego State University are working together to help us complete that comprehensive statewide needs assessment. And a representative from PROMESA, Mr. Marzullo, who is with us, is going to provide some information about our needs assessment. So I will now turn this over to.
Thank you, Director Reese. I appreciate the introduction and delighted to be here today with you all and to share with you some information about the comprehensive statewide needs assessment. I'm joined here today by Larry Wilson, who's our president and CEO, Marcia Thompson, and Vanessa Brody, and Kalila Wood, who are some of our subject matter experts. As Director Reese indicated, we're also joined in this effort by representatives from San Diego State University, who are assisting us in doing some of the statistical calculations and correlations related to the data that we collect through this process. And so it's an outstanding team with experience in working with the district in the past. So we're all pretty familiar with what's happened historically, and gives us insight into how best to conduct these assessments. So today we wanted to provide you with kind of an overview of the assessment, the process. So we'll discuss sort of how it's going to be conducted, how we'll perform it, who can participate, how the results will be used to strengthen those vocational rehabilitation services throughout the district. This is one of the most important activities or planning activities that really takes place within the rehabilitation agency, because it helps ensure that programs, services, investments, that they remain responsive to the overall evolving needs of the individuals with disabilities. We can move on to the next slide. We wanted to first try and get a sense of who's on the call today, and this will help us a great deal. So it's always kind of fun to get a sense of who's with us. But we should have a little poll that just pops up on your screen. Hopefully we can take care of that. There you go. And if you wouldn't mind, just go ahead and select one of those categories as to whether you're a provider or community organization or just a person with a disability or family member, any one of those. And if it's not listed there, just go ahead and click other. But this will give us a sense of who the audience is today, and we'll have a little bit more interaction throughout the presentation where we can collect some meaningful information from you and get your thoughts why we're spending this time together today. All right. Give you one more second. Okay, thank you for that. We'll move forward now. I'll be moving pretty quickly, so just keep that in mind. We've got a little bit of a limited time schedule today, but we'll do our best. I guess you can see kind of the poll that's popped up, the results, which is great. So we can see the vast majority look like they were in the provider community, which is terrific. So moving on to our next slide. we really wanted to talk about, well, what is the CSNA, which is our abbreviation for the Comprehensive Statewide Needs Assessment. So either way, you get a mouthful with either the acronym or the full name. But it's a evidence-based understanding of the needs of individuals with disabilities throughout the district. And it's important, the assessment is designed, to evaluate individual counselors, staff, programs. So really to identify all of these needs from different perspectives. So it seeks to identify opportunities to improve outcomes, expand access, and strengthen service delivery. It considers both individuals currently receiving services and those who may be eligible for services but not currently engaged, or maybe not receiving sufficient services. So it really is designed to cover those that are receiving services and those who are not receiving services, and why, so that those services can be, and the organization can be better aligned with the needs of the community. So moving to the next slide, why does it matter? Well, for one thing, it's both a federal requirement and it's a strategic planning tool. So while it's a federal requirement, yes, law requires this, that's terrific, but it really is intended to be a very thoughtful strategic planning tool, and really essential for what the agency does in looking ahead. So the findings are going to help inform the future priorities and ensure that rehabilitation services continue to evolve in response to those community needs. In a structured way, the evidence is gathered, we've engaged stakeholders and identify, sort of practical opportunities for improvement. Next slide, please. So just to, by the numbers here, district disability baseline, give you a little bit of sense of some historical information. But we look really at this information is really to provide sort of a basic or a beginning understanding of the population itself. So you can see that more than 87,000 district residents report at least one disability, with a disability prevalence rate of 12.6. So the CSNA is going to help us to understand how effectively services are reaching these populations and whether disparities exist among demographic groups, geographic areas, or even service outcomes. So building on the previous sort of findings, we don't begin with a blank slate. And the whole idea here is to be looking backwards and forwards to mark progress and look at those needs. So we'll look at the previous assessments that identified, and then look at those things, those themes that may be reoccurring, and make those recommendations. And so this gives us the ability to evaluate progress over time. So it isn't just a 1-minute snapshot. We are really looking back so that we can look informed looking forward. So our goal really here is to evaluate, whether the findings remain relevant, whether improvements have occurred, and whether new needs have emerged due to, maybe changing economic circumstances or demographics, or, even workforce conditions. Who knows what AI is going to bring, or things of that nature. So moving to the next slide, kind of what stands in the way. So this is another little quick poll we wanted to take to get a sense of, where you see the biggest barriers to employment for people you serve or represent are. And so when the poll pops up, if you don't mind kind of just putting these in order, just ranking them 1 through 6 there, that'll give us a sense of the priorities based on those. I'll use that as an opportunity to take a sip of coffee. And this one might take an extra minute or two. So I'll give you give you a second there to do that. And hopefully it's intuitive. You just select the drop down associated to each barrier. So barrier 1 being the biggest, barrier 6 being the least that's identified there. And you just select toggle and you'll get a drop down. Okay. I'll go ahead and move on from here. Oh, okay. It gives you, should be seeing some of those results now. It seems that transportation seems to be among the highest in terms of barriers there. It's fascinating. And then, of course, it looks like awareness of RSA services ranks pretty high as well. So thank you for this information. This will be very helpful, and we will certainly utilize this as an input into our assessment process. Thank you. And let's see, move on here. So some of the core research questions, these kind of guide, every component of the project. But every survey question, focus group discussion, interview protocol, any analytical activity, it's all designed to help answer one or more of the questions here. What vocational rehabilitation needs currently exist in the district? What barriers affect employment, independent living? Which populations are underserved or receiving inadequate services? Which populations may not be accessing services at all? And last but not least, what program or policy changes could most improve outcomes? So the ultimate goal here is to develop actionable recommendations that are supported by these multiple sources of evidence. And we'll move forward. So how does the assessment work? Easy peasy, right? Well, there's no single data source can fully explain the community, right? Just what we've seen. We have different stakeholders who are involved, different sets of needs. So we use different methods. And among those, surveys are going to provide various perspectives. We'll use focus groups as well to provide context to those survey outcomes. We'll use administrative data that provides measurable outcomes. We'll use public data sets to provide, population benchmarks. And so the strength of the assessment really is the integration of all of these different data sources. So be comfortable and confident that we are going to be looking at this from just about every practical perspective and dimension in terms of data collection or historical data that is available for this purpose. So what's the process look like? Okay, well, pretty simple. We go through our planning, community engagement, data collection, analysis, put together findings and recommendations, and then there's a state plan and future. So it's a pretty straightforward, linear, typical type of project where we've got, of course, we're trying to develop that, perform that planning and engagement early with a lot of the various key informants, stakeholders, others, perform that data collection, as I mentioned, through those surveys and focus groups, and then do the analytical pieces of it, where we take all of that data and put it together in a way that it has meaningful outcomes and certainly inform future decisions. So we talked a little bit just a second ago about, sort of stakeholder engagement. What's the strategy around that? So how do we get broad participation, which is essential to the process? So, the strongest recommendation emerge when we have diverse perspectives that are represented. So it's not just one group or another, that we really are taking in as many perspectives as possible to get the best representative recommendations. So we want to hear from people who use services, people who may need the services that aren't using them, and organizations that interact with the individuals as well on a daily basis. So you'll see here those different stakeholders broken out, whether they're individuals, whether they're advocacy organizations or rehab providers, workforce partners, employers, transition age, youth and students, really just about everybody. I won't name them all. There are a few more that are on the list that you can see there, but it is a broad swatch of interests. So looking at the key informants, and this is a critical component really for influencing our focus groups. We want to make sure that we are looking to RSA leadership and staff and State Rehabilitation Council, workforce system partners, and other community advocacy groups, education transition partners, and of course, VR service providers, and to bring them into the fold very early in the process. So they're not just simply stakeholders in this case, they really are selected participants where we do in-depth interviews because of the position, expertise, or their institutional role, or just direct experience with the population themselves. So unlike the focus groups, which will follow, key informant interviews are structured in a qualitative method. So they'll allow our assessment team really to probe specific issues and test emergency hypotheses and gather more nuanced perspectives that maybe the survey data is not able to capture. So as I mentioned, I won't go into too much more about it, but these are really important groups of people that we will meet with to help formulate our many questions. We can certainly talk more about that, but in the interest of time, I'll keep us moving. So how are we going to get to everybody? Well, what we have done, as I mentioned, that we do surveys, we'll do focus groups. We have put together what we refer to as an engagement hub. It's sort of our primary vehicle for public participation. So it's designed to provide stakeholders with information about the project, its opportunities to engage throughout the assessment, and stakeholders can visit this at any time at csna.promesacgi.com. We'll put that up again a little bit later, but it is intended really to provide sort of a single stop place for all of this, the assessment related information and how consumers can participate via the surveys, focus groups, and other surveys for different populations. So it is a central sort of landing spot so that everyone may participate in the process. So we'll move to the next slide. And this really is a question that's sort of designed to get at, who are we missing? Because we really are truly interested. I know the agency and Director Reese are very much interested in identifying those who are perhaps underserved, who are not being serviced at all. These are very important populations. But who else might we be missing here? And we've got some listed. And when the poll pops up, if you don't mind making some selections, we would certainly like to hear from you. So give you a little bit more time to think that one through about who we might be missing. Just drop that in the poll. Okay, great. We'll move forward. Sure how our results will come in, but I guess they'll pop up. So we can move on to the next slide.
Did the polls pop up on your end?
Well, no, in fact, it did not.
Okay, it's open on my screen, but it didn't look like it didn't pop up. I'm sorry, once.
Yeah, people are indicating in the chat. I see that the poll hasn't popped up. There we go. Hopefully everybody can see that poll now. And if you don't mind sticking, try and name a group that you don't see listed up there. And I'll give you a few more minutes. I know there's a lot on that one. Okay. We'll keep things moving here. Just try and get through this quickly now. So moving to the next slide, if we can get there. Oh, there are poll results. Everybody gets a sense of which groups we may be missing there. And interesting. Okay, thank you. So yes, moving to the next slide and looking at these underserved and the potentially never served populations, the traditional outreach methods, they often fail to reach every community. So we recognize that this is a problem. It's a challenge, not just for the district, but across the board as to who that poll popped up again. Okay, thank you. So the assessment includes targeted strategies or strategies we're using to target those groups to better understand those populations and the barriers that they may face. That's the importance of that question we just asked you to really get your a little bit of input there as to where you're seeing or which groups are not being potentially recognized. So we're giving this special attention really to foster to foster care youth and justice involved individuals, those experiencing homelessness or veterans, or those with limited English proficiency, and any immigrant communities that are out there. And hopefully we're getting that translated so that those folks that may be listening in a different language, that we are able to get their input as well. It's important to us. So looking ahead here in the next slide, students and pre-employment transition services, looking at the groups here, students and transition aids, youth, they remain a pretty major problem, pretty major area of our focus because early intervention often leads to stronger long-term employment outcomes. So the assessment will evaluate whether existing pre-employment transition services effectively support successful transitions into employment and post-secondary education. So let's take another quick little pause here, take a little poll and see how we are doing on the core needs. So you should get two questions that pop up on your screen there, one of which is how well is the system meeting the needs of transition age youths with disabilities? If you could just choose 1 through 5, and you get a little rating there of not at all, not adequate, very well, fully adequate. And then the second question, how adequate are supported employment services for individuals with the most significant disabilities? Great. Okay, terrific. we'll keep things moving here and move on to the next slide. There we go. There are results. And it gives everybody a picture there that so not doing as well as we could. Okay. Thank you. So looking at sort of the administrative data analysis, it allows us really to move beyond sort of the anecdotal, sort of evidence and really identify measurable trends and service patterns. This really is data driven. So while it's nice to get the qualitative data, the quantitative data is really quite useful in making sure that we're able to identify any trends, patterns, get a very good picture. And so it's one of the most important analytical components really of the assessment. All the data is handled as de-identified data, by the way, so that there's no personally identifiable information that's requested or retained. So what limits our capacity? We'll now take another quick little poll here. And I think, promise you, we're about the end of our polls. And we'll take a look here at limits and capacity. So what most limits provider capacity to serve more people? So when that pops up on your screen, if you wouldn't mind selecting your choices there. Hopefully there's a little more fun than normal. You get to choose a few things and be engaged. But it's an excellent opportunity for us to get some of your input, so we appreciate it. Okay, move on now. Keep this going. Thank you. And so just kind of project timeline. This is high level stuff, really a little bit more project management, just to give you a sense where we are. We really have been doing most of the planning through much of May and June. The data collection really is beginning now, primarily in July and August, where we will be running our respective surveys and holding our, beginning in July, our key informant discussions, and then our focus groups. And really that last part of August, September is when we'll be formulating our results. So by the end of September, the results of this effort should be available. At least that's the intention. I think we're on track for that. So, collectively, all of these different deliverables, they support a final assessment, which is going to be inclusive of recommendations. And as I mentioned, we're looking forward, but we're also looking back. So we want to see just what happened coming out of the recommendations in 2020, in 2023, and then where are we in 2026 and beyond. So how are the results going to be used? Pretty simple. We're going to look at outreach strategies. We're going to look at employer engagement, pre-ETS initiatives, community partnerships, service delivery improvements. And then, of course, the state plan. This will all be rolled into that as well. So it really is a guiding assessment for planning purposes and instrumental in how the agency looks forward and looks at how needs have changed over time. So we'll take, I think, what is one last poll here. I won't promise you. I think there might be one or two, and we will be done here. But we would like to kind of know, where should we be focusing? As RSA builds, the next state plan, where should it focus? And this one is a little bit of a complex chart. So do your best You can select one on each row. I was hopeful that this was a little bit more of a drag and drop, but we couldn't unfortunately figure out how to make that work. So we'll do the best that we can with this. I'll give you a few more minutes on that one. 30 seconds or so. Okay, so moving forward, give you a quick snapshot. So what is success really going to look like? Well, there are poll results. As soon as I start talking, of course, they pop up. So you can kind of get a sense there as to where folks really think we should focus. And looks like between outreach and employer engagement. Yeah, this chart is a little difficult to read, so I won't go through that at this moment, but we'll certainly make this available. So what does success look like? Well, it's clear understanding of the current needs, better visibility into underserved populations, greater understanding of the barriers, and to really have some data-driven planning tools. And then, of course, really the most important thing is to have actionable recommendations that the agency can use to move forward to make sure that needs are being addressed now and in the future. And so we'll move to the near last slide, and just to give you a sense, this is how you can participate, and we really do look forward to your participation, whether it be via survey or focus group. And if you go out to the csna.promesacgi.com, you'll find information about the respective surveys and the focus groups for each of those stakeholder groups. And you can currently sign up for focus groups, and the surveys will be launching very soon. I think probably early next week, we'll have all of those surveys up and operational there. So please look to that and participate, whether it's by survey or focus group. We'd love to have your input and certainly share this information with others as well within your organization or within your respective networks. And then we're going to take one last poll, and I will turn this back over to the director. And it's a real easy question. And that is, if RSA could change one thing to better meet needs in DC, what should it be? And this one you can be long-winded. I want to thank all of you for giving me the opportunity to speak with you today, and we're certainly available via email or telephone call. Certainly reach out, and we'll be happy to address any questions or needs that you may have. Thanks a lot, and I'll turn it back over now to the director.
So I don't see any questions in the chat, but you did refer to how people could contact you if they are interested in participating in providing input to the needs assessment. Are you able to type that information in the chat, or if you can tell me right now, because you were talking?
Yes, you can just go out to csna.promesacgi.com, and that information is all available there. And there's contact information for me there as well. And I'll put that in the chat as well. And if we go back a slide, they can scan that QR code, and that'll take them to that site as well. So if you look at the lower right-hand corner, you can see that you can reach out to Brittany in DC, me here at Promesa. My contact information is there. We'll get that out to the group. I also did put it in the chat box, so you'll see that web address and you'll also see my email and telephone number. So feel free to reach out. And like I said, on that website, you'll find everything there is you'll need to know to participate.
That's great. And I just entered it and looked at it, and it really is thorough in terms of seeking out all the different stakeholder groups we would like to get input from. So thank you very much.
Thank you.
We look forward around September to hearing the results of the needs assessment.
Great. Terrific. Look forward to providing them.
So next up, Crystal Thomas and Shannon Austin from DDS are going to talk to us about regarding
benefits, counseling, and resources. Thank you, Director Reese. Again, my name is Crystal Thomas, and I manage policy planning and innovation at DDS, and I am with Dr. Shannon Austin, who is our RSA Deputy Director. And we are going to share some of DC's planning, benefits planning system and resources. I know since I have been working in human resources 20 plus years, one of the biggest barriers to people desiring, accessing employment is benefits, right? I don't want to lose my housing. I don't want to lose my Social Security monthly check. I don't want to lose SNAP, on and on and on and on. And we definitely want to emphasize the importance of benefits counseling to meet with someone and look at your specific benefits. But I am going to go in a little bit more detail. So back in 2025, the Department on Disability Services developed a three-tiered benefits planning system. We shared this a while back, but we did post the resources to our website. So the tiered system includes the initial one is for ambassadors. So that's for our DSPs, our intake workers, service coordinators, as we are having conversations for people's employment, people's ISPs, IPs. These folks, it's important to have an understanding, a basic understanding of the do's, the don'ts, the myths, so that we are not sharing incorrect information, right? The next tiered system is our benefits navigators. That includes our employment specialists, VR counselors, employment coordinators, and so forth. And so that goes into a little bit more depth and our planning, benefits planning system. Last is the benefits planners tier system that really focuses on our certified planning planners. And I wanted to just share on our website where we posted am I here? Hello?
I'm sorry. Yes, I can hear you, Crystal.
Okay. All right. I went black. Hold on just a second. Okay. Zoom blacked out. So I will share some of the resources that we've posted to our site. And let's see, 1 second. Just make sure that okay. So I will put these links in our chat, but wanted to show everyone where we posted our benefits ambassador resources. So again, these are for our DSPs and other service coordinators that show the do's, the don'ts in regards to benefits planning. We've listed some other resources, but we also posted a training, how to know enough about disability benefits. And just to play just
Enough, we'll stop.
there is a
Okay.
54-minute training on the do's and the don'ts. And I know for myself, I have to review some of this once or twice a year because some of the rules, if I don't use it, I lose some of the information. On this page, we also include our SSDI comparisons between 2025, 2026. We also included that information in Spanish and also the training slides. So that is our benefits ambassador resource page. Next is the Navigator resource page. And this is, we would say, is appropriate for our employment specialists and coordinators. This goes into a little bit more in-depth training in regards to referrals and how to make referrals and access benefit planners. Here is the training that we've posted on You Can Get Public Benefits and go to work and live to tell about it. So more information on this specific training, along with other resources for folks, and that includes in Spanish as well. So that is for our benefits navigator. And last, we posted for our benefits planners. My screen froze. And this is a little bit more in depth. So these are for our more seasoned folks that we recommend. That includes more information in regards to benefits planning. There is a certified program that VCU offers, and the Cornell program also offers, if anyone is interested. So here is the training for some of our benefits counselors. We also included, again, the PowerPoints along with other resources. So I will stop sharing that and also include, hold on just a second. I'll put these links in the chat, but wanted to just share this with everyone. Other resources that we have is our resource guide. And this is just a quick, I won't call it a one-pager, but this is a quick resource for here in the district, right? So we included links, phone numbers, so people can access financial resources. So of course we have this Department on Disability Services. If people with mental health challenges want to access how to keep jobs. We have DBH telephone number on here. We also have, let's see. If you need information for taxes, we have that information on here as well. If you want to learn how to manage money, if you need support, and once you get your job, we can support you here in managing your funds. There's also, if you are looking for homes, um, uh, to support your dream in buying a home, we also have resources here as well. So I find this information incredibly helpful. So I will put this information in the chat, and I also, of course, have slides. I'll put that in the chat as well. So I will turn it over to Dr. Austin.
Crystal, I actually shared the links and the attachment for the resource guide in the chat for you while you were speaking.
Thank you. Appreciate that.
Good afternoon, everyone. Just happy just to be on the call to co-present with Crystal. I think just like Crystal and myself, we've been in the human services for a very long time, and I think like some of you guys on the call, providers, counselors, and staff, I think we know that benefits counseling is one of the biggest barriers that would prevent someone into going into work. So the more that benefits counseling is going on, it's going to be a benefit not only to that person, but families to get people to work. And I think when you have it sooner than later, that even helps even more. Because I think sometimes if that discussion is not taken on the front end in trying to get someone to work, you find yourself thinking that maybe they don't want to work, but you might not know why. And it's usually wrapped around benefits. Especially if someone is in multiple systems, like Crystal said, TANF and SNAP and housing, and really trying to figure out if there really is a benefit to going to work. So you have to have some of those practical conversations to see what it's going to look like when someone is transitioning from a benefit and no longer having it because the cliff is real for families that are trying to transition from SSI and SSD or any other type of benefit system to really going to work. There was a survey that was done and a lot of engagement last year that was done within the agency. There was several outreach events, live trainings and virtual trainings, were several individuals, over 369 individuals that were engaged with, over 12 government agencies, several community providers and organizations, advocacy organizations that we did engagement with last year. And what we found based on the feedback of that engagement last year was that 77% of those individuals were going to refer people to benefits counseling. And 79% of those individuals agreed that they felt more comfortable in answering questions about their benefits and work after the training. So it's critical that people receive information so that they can make informed choices. The other thing that we know that really motivated people to come to the training and really maybe make a deciding factor in order for them to go to work is they really needed to understand the impact to their Social Security and SSI benefits. I think they wanted to understand what's going to happen to their health care or their Medicaid. Families were concerned. Some of them are payees. They needed to understand how to submit the necessary documentation to Social Security once they began working. Because what we don't want is individuals that begin work then have an overpayment because they've went over that threshold, and submitting the necessary documentation as their if they hit SGA in particular. So I think it's very critical in understanding like where they're coming from. Understand that even though it may be fear, but as information is shared with individuals, it's going to help them to decide to work, to make that decision and make an informed choice in order to do that. There's two ways in order to receive some type of benefits counseling. Of course, it's through the Ticket to Work helpline, and then, of course, doing application with RSA, and then being assigned with our benefits counseling internally if you have an application within the agency. Some lessons learned that we learned from last year. One, individual sessions are critical to moving forward, but not just to the individual, but also to the family, so that they understand the individual's benefit. Because a lot of times people may be with a family or family members. They might be payees, so it's critical that they understand the impact to them and the person that's receiving the benefit. Our goal over this year and going into the next year is really to give updates on Medicaid and the impact to that and changes that are going on. But we really want to make sure that we're expanding so that we can understand veteran benefits, those receiving workers' compensation, SNAP and TANF. There's several changes that are going to impact the district of those that are currently receiving those benefits. And we want to make sure here that DDS is really a safety net for individuals that are really desiring to go back to work, and so that we can help them through that process. The other thing that we want to be very, another thing that we learned is that in order to increase our participation in the Ticket to Work, we need to make sure that we're building out an infrastructure that really looks at the long end game of really getting people to work and making sure that we are looking at it as a continuum within our system and how people are going to go through our system. Really, I think our vision, is to coordinate DDS benefit planning really as a continuum that really connects outreach, education, how people get to employment services, and then the long-term supports, so that everyone coming through our system is able to achieve and make informed choice so that they can pursue competitive integrated employment within our system, so that they can be in a place of financial independence. With that in mind, we need to make sure that there's a system that's connected at every level. And one of the things that we've had several conversations internally within DDS is looking at how a person that receives SSI and SSDI is going to flow through our system. It starts with community outreach, of course, and where we're trying to outreach to individuals that may have a ticket to go to work and maybe engaging with family members and making sure that we're a resource to the district in order for people to outreach to our services. But then internally, making sure that DDA and RSA are coordinating those services and making sure that and that all that's going on, but just trying to refine those to make it easier for individuals going through our system. Application, of course, but then we've been thinking and considering looking at doing Social Security benefit overviews within our system so that people understand not only after application, but they understand like what's going to be the impact on their benefits as they're coming through the system so that they can make an informed choice as they go into the planning phases where they get more individualized services with our benefits counselor to when they do get to work and have and be considering those things as they're thinking about employment as the end game. Uh, I think we're thinking about our system in a whole, we need to make sure that we're engaging early, coordinating those services as they come through DDS, so that individuals can make informed choices within our system, so that long-term outcomes can happen. The other thing, it's not specifically to the Neon grant, but it is specific to the Neon grant, but we've also had other conversations internally and have received some level of technical support. But thinking about employment networks and partnership plus agreements that we can potentially have with providers, so that just like individuals are coming through our system, working with DDS/RSA, DDA for employment goals, that as we transition them out of our system, even though we are doing looking at second and fourth quarter outcomes for individual to make sure they maintain employment, really trying to establish partnerships where it can kind of wrap around that individuals for the long term, for individuals that are coming out of our system. So we're hoping to have some conversations, hopefully in the near future, about partners that can do the long-term follow-up through a Partnership Plus for those that are receiving the ticket, in particular. Um, and then just to really kind of close out, um, the critical and important aspect of what we are doing in the agency, it's critical that we get on the same page to really walk in the shoes of the individuals that we're serving. Um, Even if we don't understand it, we need to see through the eyes and walk in the shoes that in the things that they're going through. Because even though it's easy to get lost in the mix, and we need to make sure that, we're an agency where it's person centered, but we need to make sure that we're looking at the person holistically and as individual first. That we need to look at them as they're doing their career goals, so they can make informed choices, and, they can get to their employment goal that they have set forth. And with that, it's really going to take a village of us to kind of come together to make sure that not only are we helping them into their now, but where they want to go when it comes to employment. And I think as we work together to increase competitive integrative employment among various populations, it's going to take all of us to do that and to really get on the same page and make sure that we're kind of bridging those gaps so that people aren't falling through the cracks, and trying to get to employment. And I think as we continue to build strong relationships with providers and employment networks, we'll be able to get where we need to be, not only as an agency, but helping individuals to meet their dreams. That's all I had. I know where you guys are going to get a copy of the PowerPoint, but just glad to speak to you guys about benefits counseling. I know that it's one of those things that keep reemerging, in small circles about getting people moving into employment. But this is a conversation that we need to continue to have so that we can get people into jobs. Thank you so much for being able to talk to you guys today. Andy, back to you.
Thank you. Just checking to see if there are any questions in the chat. I have seen requests to post the links, and the links are in the chat. Okay, I don't see any questions. So thank you very much to all our presenters today. And as always, by next Wednesday, the recording as well as any presentations will be posted on our website. Have a great weekend, everyone. Oh, I should also mention that this upcoming week is the 90th anniversary of the passage of the Randolph-Shepard Act, which created the Randolph-Shepard program, and which is also known as the Blind Vendors Program. It's a program that provides employment opportunity for people who are blind, and we'll be having a little event this weekend with a number of the vendors involved in that program. I do see, let me just say one note about the videos. The trainings are divided into chapters, so you can jump to specific topics that you may wish to review. Okay, have a great weekend, and we'll talk to everyone again next month.